Hi, I'm Meredith, a nurse practitioner at AesthetiCare, and we are talking about Aveli today. This is Jessica, another nurse at AesthetiCare.
Hey guys, very excited about Aveli. It's going to be a great little fill-in where we were missing a good cellulite treatment, so we're excited to tell you guys about it.
So cellulite, especially for women, is when we have bands, especially in our bottom and our thighs. I think we're all familiar with that. For women, the banding is not even. So as we gain weight, go through hormone changes, lose weight, sometimes you can see that cellulite a little bit more defined. And it's not laxity, but it's those deep dimples that we've had forever and ever we just can't get rid of.
So Aveli is a very precise treatment that is going to be done by either our medical director, Dr. Carter, or Meredith here, who is a nurse practitioner. And what it does is it targets individual bands that cause those specific dimples. What's great about it is we only have to make usually only about one incision on each side, depending on where the cellulite lies. So there's not a bunch of pokes, a bunch of holes. We brought Aveli on just because we had, over almost 90% of women have cellulite, and there's not a lot of treatment options out there. We had a treatment before that was great. However, unfortunately during COVID, they went out of business and we weren't able to proceed with that treatment. So Aveli was the perfect fill-in for that. It's nice because, like I said, we don't have a lot of prep involved. There is some downtime associated with that, but that's something that we'll go over during the consult. So we are so excited to finally have a permanent solution for cellulite when that is something that, almost all of us can complain about.
There's nothing else on the market that can compare to Aveli right now. This is a treatment that treats the cellulite from the bottom up, so under the tissue up. A lot of treatments are trying to treat it from the top down, which doesn't effectively cut the bands. Unfortunately, we're just going in. It's called subcision. Some physicians or practitioners can do it with a needle. This is a specifically designed needle that goes in with a very precise cut with a light, so we can actually see the actual band by pulling the tether to see exactly where we're cutting. So it's very precise.
So Aveli treats specifically cellulite. A lot of people will assume that they have cellulite in places that isn't truly cellulite. Cellulite is most often seen in the gluteal area, back of thighs, lateral thighs. It's the specific dimple that causes that little anchor, which causes the dimple. As we age, unfortunately, I always use the term everything heads south, but when we lose that elasticity in our skin and everything starts to kind of drop, it can take fat with it, and it'll give almost like a rippling texture to it. And a lot of people, unfortunately, will think that is cellulite, but that's not truly cellulite. True cellulite is an actual dimple caused by a textured connective tissue. So the great thing is our consults are always free here. Whether it is truly laxity or true cellulite, we'll be able to determine that in one of those consultations and kind of come up with a game plan that is very specific towards you. Because like Meredith mentioned, it may be a combination of Aveli and Sculptra. Maybe it's just Aveli, or maybe we look into something more that is tissue tightening. Maybe it's cool sculpting. There's so many different areas that we're able to treat here at AesthetiCare that, no matter what your issue is, the chances are we have something for it.
Okay, so this is the Aveli handpiece, and you can see this little red light. It actually guides me exactly in the space that I need to cut. So I go right into the tissue after Jessica or I numb you, so you're local numbing in the area, and you shouldn't feel a thing. And I can activate the blade, pull down, and I can see exactly where that blade, the septi, is pulling deeper into the dimple, and then activate the blade, like I said, and it'll pop that little dimple right up that we don't want to see. So the downtime is about 2 weeks. So it's similar to if you've ever had liposuction surgery or anything like that. You're gonna have some bruising, you're gonna have some soreness, you're gonna wear compression hose for as long as you can for about 2 weeks just in the area that you don't have to wear long compression hose, just in the area that we've treated. We will work with you and keep in touch with you. We can do some post Z-Wave to decrease the risk of any nodules, but bruising and soreness is gonna last about 2 weeks, and we'll see the best results in about a month to 6 months.
So after your treatment, like Meredith mentioned, you will have some swelling. It's a great idea for us to get you in here to do anything to boost circulation in the area that we treated, because it's going to help with that post-inflammatic response, hopefully speed up bruising a little bit. But it's not a quick thing, or I'm sorry, it is a quick thing. It's not a long drawn out process. So once you have your treatment, those dimples are popped. It's more just healing from the actual trauma that we've introduced into the area, so the bruising, the swelling. So there's still plenty of time, to get this done before summer, before short weather.